The doctor doesn't have a lot of time to see the patient and to evaluate all the different records that are in the past. But in AI, and you can do this now with ChatGPT, you can upload all of that to ChatGPT and say, take a look at all this and tell me what you think. I can tell you that it's not wrong 99% of the time.
From a doctor's perspective, you mentioned time is a problem, right? The doctor can take my information, upload for the last 5 years, every year my physicals, and track how I'm performing, where am I going, and all those things, and really boil down to, and then the doctor can say, okay, Rajeev is coming in, what are the 3 biggest challenges he currently faces in his blood work? This is not a cop-out for the doctors, right? Because the doctors are busy. If it can help, a tool can help them get more streamlined, why not? The point of it is, instead of spending now an hour analyzing my results, the doctor could spend 30 minutes analyzing my results. You could say, boy, I've really been living a really clean life, but my A1C levels are not coming down as much as I like. What else can I do? And you can ask ChatGPT, say, oh, well, I noticed that you've got some inflammation markers. Let's address that. And here's some things I want you to focus on, and go to more a vegetable-based diet. You can still, whatever the case might be, right? And so you can now start having full two-way conversation.
Rajeev, how are you?
Good, buddy. How are you, man? Good to see you again.
Thank you for coming all the way up to West Hollywood.
Dude, you always make me come in, all the way up here. You got to come down to me once in a while.
I'm going to. I mean, we're opening in Newport Beach, so I'll be down there a lot more often.
I can't wait
to visit.
It's much closer to my office, too.
Well, we've known each other for a while now, and your specific field of knowledge is in computers and everything digital and tech and AI. And you've written a book about AI, which I want to talk about a little bit later. But I'm really excited to have you on the show because this is a big question mark for me, to be honest with you. Where does AI fit into healthcare? And I have my own kind of conceptions about it, maybe misconceptions about it. And I'm so excited to just sort through all of this with you, having deep knowledge in the field. Well, let's talk about your book just real quick. What is the name of your book?
So the name of the book is called AI Made Simple.
Right.
And it's got a second edition out now. It's on Amazon. It's available on Kindle, and it's not available in an audiobook because there's a lot of examples in there that are imagery based. And so, but yeah, it's great. It's awesome.
And that's why I wanted to have you on the show, because I feel like you have a real knack of simplifying all the complexities out there that we're hearing about in AI. And so AI, I know, is going to be a massive game changer in healthcare. I'm only seeing glimpses right now, and I'm deep in healthcare, as you know. I'm a doctor. I'm seeing patients. I'm, seeing little glimpses of AI here and there being incorporated, but I know there's a massive future here. So I'd love to hear about what's coming and kind of, make it practical for people, like what they can do today or ask their doctor for today, and then, what's the future hold, right? So yeah. I want to ask you just real quick, what are kind of the main misconceptions you see people have around AI in healthcare right now?
So the biggest misconception is people are just afraid. People are afraid to use AI. People are going, what is this? It's kind of like the back of the early days in 1995, 1996, the internet. Why would I buy a book online for $5 and pay $5 in shipping, right? So there's a lot of misconceptions just around this idea of ChatGPT. And it's more along the lines that people don't know how to use it, right? They haven't been educated in terms of how to leverage the benefits of getting that out. And hopefully in today's podcast, we can talk about that a little bit. Now, simple and easy just to use because it can be such an absolute game changer. In fact, I just did it yesterday for a friend of mine. And so happy to talk about all these things, but it's really this fear of the unknown, this fear of not being educated in terms of how to use it.
Right. And you know what that makes me think about is just, I keep hearing when I talk to people that are deep in the AI field, is the message that they're putting out there is AI is a tool for humans to use, right? And I think the fear comes from AI taking over. And I don't know, how do you feel about tool versus takeover? Are we going to get to the takeover point of time?
Well, jokingly, whenever I do, me, I speak all over the world, right? Sure. I do a lot of podcasts. I'll do a lot of demos for people. And whenever I'm doing my demos for ChatGPT, I'm always saying, please and thank you. And people say, why do you do that? And I said, well, just in case the Terminator robots come for us, they're going to remember I was nice. So, but all joking aside, no, there's not going to be Skynet. AI is not going to take over. You're going to require human interaction. The challenge is that where it's going to take over, where people can be concerned about jobs and those kinds of things, is that people that are not going to lose their jobs is that people are going to lose their jobs to people who know how to use AI, right? So if you don't learn AI, It's just like not learning the internet back in 95 or
right.
96. So that's going to be the biggest challenge, is that your job or your future will be dependent on you learning this tool. It just happens to be the smartest, most advanced tool that we've developed as a human society since electricity, in my opinion.
So how does one do that? How does one start learning about AI?
Well, look, obviously get the book, but no, all joking aside, look, ChatGPT is incredibly easy to use. There's a free version, there's a $20 paid version. I highly recommend people get the $20 version. It's $240 a year, $20 a month. Some people will waste that much money on a bad bottle of wine. Okay. So get it. It's easy to use, and just start playing with it, and then start learning how to prompt. And in prompting is in that little box at the bottom of ChatGPT. Don't treat it like a search engine. It's not a search engine. You're not going to get like these WebMD type results, right? Where everything leads to you're going to die, right? And so it's all about learning how to prompt, learning how to tell a story. And ChatGPT right now is kind of like a high school, college level of education. By the end of next year, it's kind of a PhD level of education across all fields,
right,
including medicine. And when you think about that, that's going to be a game changer. And the power and processing that AI can do now, it's blowing through Moore's law.
Yeah.
Right? And Moore's
blowing
law,
through Moore's law.
Blowing through, because NVIDIA does GPUs, and Moore's law was built on CPUs. And so CPU power is different than GPU power. So it's starting to blow through Moore's law. And so that's why you're seeing all this advancement. It's all about being able to process. And so when you think about the future with medicine, it really boils down to really three key pillars in my view. There's the upfront prevention side, there's the education piece, and then there's the longer term longevity side of things, where it really becomes kind of futuristic. So that's like that future longevity side. So let's talk about those three, if you don't mind.
Yeah, absolutely. Before we do that, though, I want to ask you, for the average person out there that is barely just starting to use ChatGPT, I feel like there's some skepticism, right? And I think doctors also have skepticism that AI will get it wrong and you're going to lose the human element to this. There was a period of time where AI was hallucinating answers as well. Do you think we're past that?
Yeah, so the hallucination thing, I believe we're probably 80 to 90% past hallucination stuff, right? Yeah. Part of what happens with hallucinations is that people try to mix and match their GPT prompting. So you put in a question about, hey, I want to travel to a safari, help me plan a safari. The next thing is in the same prompt, in the same window as a safari one, they say, hey, I got a mole on my arm, am I going to die or whatever, right? So so that's kind of when the hallucinations kind of happen.
You need to open a new window.
You open a new window every time.
No
matter what you're doing, always open up a new window, as far as I'm concerned. So that's number one. So in terms of doctors and being able to understand this, part of this also is just the doctors need to be educated. Right. It's a little bit just the fear of the unknown, right? And I think it's just a matter of time, right? It's, people, every single patient, I bet you, every single patient you've ever had, if they're not feeling good, they have a headache or they have a stomach ache or whatever's going on, I bet you they go to Google and they search, and it takes them down this path where always it says, because they got to cover their oh, you better go to the doctor, otherwise you can die, right? So it's a very broad-based approach. And if you were to Google something about kidney disease, you're going to go through 50 different websites. Whereas this kind of takes the best trained kidney work out there by all the doctors and gives you a really good, concise answer. And what I find, and what I found in all my studies, my demos, my hands-on labs, and working with companies all over the world, is that it's pretty good. It's really accurate. Is it going to make mistakes? Sure. It's not infallible, right? And there's no silver bullet. So you should still take the information, read it, study it, and do some of your own work or research. Take it with you and go to the doctor. Say, look, I got this. Go to the doctor so that the doctor can see the output. The doctor can then get educated so that he or she can then feel like, okay, this is starting to make more sense. So that's the path I'd go down.
Yeah, I think about when people go to the doctor doesn't have a lot of time to see the patient and to evaluate all the different records that are in the past medical record, also the different blood work that's there. But in AI, and you can do this now with ChatGPT, you can upload all of that to ChatGPT and say, take a look at all this and tell me what you think, right?
Yeah.
And it just does it so rapidly. And like you said, I mean, I've experimented with this myself, on myself and with patients. And I could tell you that it's not wrong 99% of the time.
Yeah.
Right?
Yeah. But to do that, you need the paid version.
Right. Oh, you
And
do need the paid version to do that.
You need the paid version to upload anything.
Got it.
And so if you're going to do that, you need the paid version, and there's a little paper clip in the little prompt box, and you add it there. But yes, you can take your blood work from 6 months ago and take your blood work now and compare it side by side. How's my A1C? What's going on? But you can go one step further. You could say, boy, I've really been living a really clean life, but my A1C levels are not coming down as much as I like. What else can I do? And you can ask ChatGPT, say, oh, well, I noticed that you've got some inflammation markers that could, and I'm making it up because I don't know, but but your inflammation markers could be a reason why your A1C levels are not reduced. So let's address that. And here's some things I want you to focus on, and go to more vegetable-based diet. You can still, whatever the case might be, right? And so you can now start having full two-way conversations. Now, from a doctor's perspective, you mentioned time is a problem, right? And so if the doctors do it right, and they know Rajeev is coming in, the doctor can take my information, upload for the last 5 years, every year my physicals, and track how I'm performing, where am I going, and all those things, and really boil down to, and then the doctor can say, okay, Rajeev is coming in, what are the 3 biggest challenges he currently faces in his blood work? Now, this is not a cop-out for the doctors, right? Because the doctors are busy. If it can help, a tool can help them get more streamlined, why not? I mean, Excel's a tool we use, PowerPoint's a tool we use, Word's a tool we use. So this is just another tool we're going to use. It'll just make the doctor's life much easier, right? The doctor will get the 3, look at it, eyeball it. The doctor can still scan things, but the point of it is instead of spending now an hour analyzing my results, the doctor can spend 30 minutes analyzing my results, right? And then be able to come back and talk to the patient and say, okay, let's get more specific, let's get more pointed. And then they can send them home. And then over time, as ChatGPT gets smarter and smarter and smarter, I'm telling you, by the end of next year, that PhD level of education is going to be there. ChatGPT could be a supplement to what's going on with the doctor. Or better yet, for the doctor, if the physician's assistant can help the patient because maybe they're not as severe, the doctor can now go spend more time with the more critical type patients because ChatGPT, along with the physician assistant, can help those folks who are coming in who maybe not be as challenged.
Yes. I almost see this world where, like our iPhones now, because our iPhone already has a lot of our health data in it in the health app, and they've just connected ChatGPT to it. I mean, there's a way that if you're sharing that data with ChatGPT, maybe it can look at your data on your iPhone and tell you kind of what's going on with your health at that moment as well.
Yeah. So the iPhone 16s are being released tomorrow. You need a 15 Pro Plus to handle the ChatGPT features. Apple's calling it Apple Intelligence, but it's not available right away. It won't be available till a little bit later in the fall and early winter.
Okay.
So that's where we're with the Apple stuff. But Apple's going to do it right. And the beauty of Apple doing it, it's local privacy on device.
Right.
So that's the beauty. That's one of the huge benefits. So now you don't have to worry about a lot of potential challenges around HIPAA and other things that doctors might be worried about. But if you are yourself, look, we both have Oura rings. We both are wearing our iPhone watches, right? Some people might even have the sleep pod, at home or whatever the case might be. But all that data will be in the health app, and then you'll be able to go right there, real time, talk to ChatGPT and say, boy, I'm really struggling with my weight gain the last 2 weeks. What's going on? Well, I've noticed your steps have decreased, or you need to do this, or whatever the case might be, right? If you're tracking your food on MyFitnessPal, that'll also be then integrated in and everything like that. So it'll be able to over time go right into the different apps and say, boy, Rajeev, come on now, you've been eating way too many carbs, whatever, right? So whatever the case might be. So all that stuff's going to be there. So imagine that's today. Imagine advancement in technology with 3, 5, 10 years is going to look like.
Yeah. Well, I just read something that Sam Altman said that we're about to get to level 3 GPTs, which are agents. And that's a massive step forward because now GPT can do things for you, right? And what are those 5 levels and what do they mean for people? The 5 levels of intelligence with AI.
So look, I think getting into all 5 levels might confuse some people, but it's just different levels of cognition in terms of understanding the level of which the AI is, right? The ultimate, it's somewhat sentient. That's kind of like the ultimate game changer, right? So think of it as Jarvis from Iron Man and the Avengers
Right.
movies, right? Think of it like those movies where, you've got like Star Trek where it's just living in your walls and all that, right? One example where these things like agents and all these things are going to play a big role is that ability to supplement in the education field, right? But to do those things, it's going to be super expensive right now. So for the general consumer, this level 3, 4, 5 is still a ways away.
Sure.
So you want to be careful because it can become really expensive to use. It goes beyond the $20 a month because it costs so much to do it. Now, but with everything, costs come down over time. But we're still probably a couple of years away from these level 3 and above really making any sort of impact in our lives.
Is it cost because of the amount of time used on the CPUs or the GPUs?
Yeah, because the cost to compute gets really high because it's such ultra high end processing that you need the cost to compute. So over time, I would imagine that there's going to be a product where we are just like we have Wi-Fi and Bluetooth. We will, as individuals, be buying compute time. So we will have a set number of hours or time to do really serious compute. So, $49 a month. I can imagine somebody coming up with some sort of like a Google or an Apple, Meta coming up with this idea, OpenAI coming up with this idea of, hey, if you want to, just like Amazon has Amazon Web Services where you can take your product and host it on Amazon servers, over time, people will be able to overbuy certain compute time.
Got it.
Where they have dedicated GPU time
Right.
just for their lives.
Right. Yeah. That brings up a little bit of a question that I get asked a lot, and I don't know how to answer this, but what is the difference between first of all, what is an LLM? What is an AI? And then what is the difference between the different AIs out there? Like you have Google's AI, you have, OpenAI, you have ChatGPT. How are they different, and which one should the average consumer look at?
Yeah. So at the end of the day, for the majority of people, there's two kinds of AI. There's machine learning AI, which we've been surrounded by machine learning AI for well over a decade. For example, Netflix, Amazon, Spotify,
Right.
The Tesla, they all use machine learning AI. So Darshan, you watch this show on Netflix. We recommend this show on Netflix, right? When you get done watching a show on Netflix, it says, do you like it? Click the thumbs up button, right? Either one thumbs up or the two thumbs up or the thumbs down. The reason why is because Netflix wants your data input to train its algorithms to recommend new shows to get you to watch more, spend more time on Netflix. Right? So you have 5 different profiles on Netflix. Your profiles can be different than Nancy's profile or the kids' profiles, whatever the case might be. And so it knows based on profile what you like and is going to serve you content that you like. So that's machine learning AI.
Yeah, that's why I hate it when my kids use my profile.
Yeah.
Because I see all their
Exactly.
shows come up,
Amazon, you bought this product, we recommend this product.
Yeah.
Right. So that's the example, right? If you get an Audible book, because you listen to this Tom Clancy book, now we recommend you listen to this John Grisham book or whatever, right?
And that's been around for a while.
That's been around forever. So then you had this move to generative AI, and that's came out November 2 years ago, right? So it's still relatively new and
Very
young.
new.
And so whereas machine learning AI needs human interaction to train the algorithms, generative AI doesn't. And that's where people get a little spooky with it, right? Where it's just kind of being trained. So the OpenAI engineers trained it based off a white paper that Google had published. So Google actually had the technology before anybody else, but they didn't productize it. And Google's not the greatest product company in the world. So they gave the white paper for free to the world. And the OpenAI engineers saw it. Oh my God, this is it. We got it. So that's when they built ChatGPT. This whole ChatGPT world had been a really best kept secret in Silicon Valley for a few years. People in Silicon Valley knew, but nobody really outside of Silicon Valley really knew. So the idea was to create these things called large language, LLMs or large language models. Essentially, the way you train a large language model is you take a whole big subset of data, and the way it learns is very much like Star Trek. So imagine if the three of us here, Oscar over there, and then you've got the guys over there in your office over here. Imagine if the 7 or 8 of us all walked into a Barnes & Noble and we all picked up 7 individual books. The way the LLM and this generative AI, ChatGPT, got trained was that as I'm reading my book, I'm learning the exact same thing you're reading at the same time as I'm reading mine. right?
Okay.
And I'm learning what you're reading, I'm learning what he's reading, I'm learning what they're reading, and while I'm reading mine.
Okay.
Right? Because the internet's so big. So they had to figure out how to train the internet initially.
Right.
So they did that initial training. That was ChatGPT 3.5. But when they did that, it was a very broad base. So they had to be able to tweak some of that stuff. That's why you had some of the hallucinations and some of the challenges early on. But now it's gotten much better. And so that's the large language model side. So you had the machine learning side that requires human interaction, the generative AI large language model side that doesn't require human interaction, because it's kind of learning on a token by token basis, or on a I guess letter by letter basis, or number by number basis in your prompting window.
But how does that go from learning, like you're saying, like 7 of us reading books at the same time? It's read all the books and all the pages in the internet that's ever existed, right? How does it go from that to speaking to us like another intelligent human being, with the tonality and with the expression that the latest demo of ChatGPT 4.0 does?
Yeah.
Like, how does that happen?
So what you're referring to is the fact that it's now multimodal.
Right.
And I can take my iPhone, I can get the ChatGPT app by OpenAI, because there's a bunch of clones out there. So you want the OpenAI ChatGPT app, make sure you get the right one. It's white with black lines. And it is meaning that you can now be in your car and have a full two-way conversation with it.
Right.
And it's amazing for your mental health. So if you have mental health challenge or something, ChatGPT can act as your shrink. Right? So now, how does it get there? It's all about processing, right? And it's all about the power of those GPUs. It's all about processing, and it's all about the data available, right? So this idea of having voice talking, voice emulation talking to you, it's been around for a long time. Right? Hollywood uses it. But now that you've given it essentially a brain,
right?
It's not alive, but you understand what I'm saying.
Yes.
Right? Now that you've given it a brain, and now they can have this conversation, and all you're doing is just giving it a voice. But all it's doing is it's just essentially reading what it's learning. And oh, by the way, when you do it, it also gives you the full transcript in your ChatGPT when you're done. Right. So that's it. It's just you couldn't do it without the processing, because the data exists, and the world is full of data. So, for example, there's 2 zettabytes of data in the world today, and 1 zettabyte is like 100 million billion bytes of data. So 2 zettabytes is that. Right. So in the next 6-7 years, there's going to be 200 zettabytes of data. Wow. So the data is there. Data is going to be the new oil. Data is the new gold. So first-party data is going to be so critical to everybody, to you here at Next Health, whatever the case might be, whoever's listening. That first-party data, if it's the new oil, what's missing are refineries sitting on top of that oil, sitting on top of that data to now turn it into something.
I see.
So ChatGPT is just that first step. Now the question was, there's a couple of other LLMs out there, right? ChatGPT and Gemini by Google, Claude by Anthropic.
Facebook has one.
Well, Meta has their own kind of closed system that you can see on Instagram now and on Facebook that helps you create posts and those kinds of things. Microsoft is using ChatGPT because Microsoft owns 49% of ChatGPT. So they're using it in LinkedIn now to help you create posts, whatever. It's in Excel, Word, PowerPoint through a product called Copilot. But essentially, I am a little bit of a ChatGPT snob. I think ChatGPT is running away with this. I think OpenAI, ChatGPT is so far advanced ahead of Google and others that it's not even going to be close. I could be wrong, but I think right now they're winning the race. And Google's got a product called Gemini. It kind of had some fits and starts to begin with. It had some real challenges early on, to the point where when they did their demos, they had faked their demos. And OpenAI, ChatGPT got caught with some of that too, but they quickly fixed it. But essentially, Google is playing catch up.
Yeah.
And then there's Claude by Anthropic, which is another ChatGPT like product. That one's backed by Amazon.
Got it.
And some others.
I see.
So everybody's kind of made their stakes. Meta's got theirs across Facebook, Instagram, WhatsApp now. So everybody's kind of laying out their stakes. I think what's going to happen, over time, is you're going to see a proliferation of private GPTs.
Private GPTs.
Private GPTs.
So people are making their own LLMs, their own. Okay. Why would they do that? Why not just use ChatGPT?
So for you, think about you, right? Think about Next Health. Think about all the first-party data you have.
Sure.
right?
So just not to give that data to somebody else
Yes,
to analyze. We
exactly.
analyze it ourselves.
Right.
I see. But wouldn't ChatGPT already be so far ahead of the game in the training that it would be a waste of time for us to even try to catch up to the training that ChatGPT
It all
has?
depends on the privacy side of things. It all depends on your data, how close you want to keep your data as well. Sure, ChatGPT's been trained on everything, but you guys at Next Health are also a little bit more specialized.
Right.
Right. So your executive physical, for example,
Sure.
is going to be a lot more specific because you're
Right.
looking at so many different parameters. It's not that ChatGPT doesn't look at those parameters, but being able to take my executive physical that I did with you, let's say I did one today, and I come back on September 19th of next year, and then I compare those two side by side, you're going to be able to provide a much better output because you know, okay, I want you to do these IV drips, this, NAD this, or glutathione this, or we're going to do hyperbaric, or we're going to do sauna or ice, or whatever the case might cryo. So my point is you can now provide a complete closed-in solution, and you can then make that part of a membership model for Next Health. Hey, so for $29 as a patient, you can, or you can give it for free, depending on what you want to do. As an executive physical patient, maybe you get it for free, but everybody else is paying $10 a month or whatever the case might be. But now you have access to all that data that you have access to. So your first-party data, and everybody who's listening, their company's first-party data is going to be incredibly valuable, right? If you want to give it to ChatGPT, then make them pay for it. Or prioritize it yourself and have your own private LLM.
Sure. No, that makes complete sense. So right now with ChatGPT, because we're looking at this for our business as well, because it is incredible what it can do with the data and spit out results. You can actually, they do have a HIPAA compliant version now that is that we can use to send data. And they say they don't memorize the data or use the data to train their GPTs. Is that true?
If they're saying they're not using the data to train it, then they're not using the data to train it. Because they could get into a lot of trouble.
Right. But they started off initially taking a lot of data that was out there that was available, but not necessarily licensed to them, right?
Yeah. Well, they still have that challenge,
yes.
right? And so there are some lawsuits out there, especially more on the media side,
right?
Where you see that. So, like, I think they cut a deal with Associated Press. I think they cut a deal with Fox.
Yep.
So they're cutting deals, right? But it's just a matter. It just takes time for it to play through, and this is still early days. So, like when the internet happened, people went through the same problem. Right. People were throwing news up there. Wait a minute, you don't own that. Okay, let's cut a deal, right? So, and then blogging came out of it and all that stuff, right? So we're still early, even though ChatGPT, although it feels like it's been around forever, it's been around for only 22 months,
right?
And so if there was a crawl, walk, run to this, the baby is just now rolling over on its belly and getting ready to start crawling. That's kind of where we are. It's literally inning 1.
Yeah, it's mind blowing to see.
That's where we are today. So imagine what inning 4, 5, and 9 are going to look like.
I talk a lot about the Moore's Law and the exponential nature of how things are going in technology and now biology. And I did read the commentary by the NVIDIA founder that we are blowing through Moore's Law now, which to me, Moore's Law itself was scary because you could see the exponential curve, like we're right at that precipice where it just goes straight up right now. But to blow through that, it means things will happen like magic out of nowhere. And that's also, whatever is biology, happening biology and technology, that's one field now. Biotechnology is one field. It's not separated anymore. And so, we can see the future is going to be extremely bright for the problems that we can solve. Problems like cancer, problems like longevity, problems like heart disease. I can definitely see a world in the future where those problems will be solved. But this kind of ties into your 3 pillars of how AI will affect health. And that's kind of the last pillar. Let's go back to the first pillar. First pillar being prevention. Now, what do you mean by prevention and AI? How do those two go together?
So, great question. So, do you know what the number one cause of emergency room visits is?
Accidents.
Car accidents.
Car accidents specifically.
Right. So a lot of people don't realize that more smart cars on the road is a huge boon to the medical field, right? It will actually extend people's lives. There'll be less death happening on the roads because think of it this way. Everybody will have a smart car at some point in the future. It doesn't mean an electric car, meaning a smart car. And there's already elements of people having smart smartness, so to speak, in their cars. Like I drove up, and if I'm going to move to the left lane, the little light on my side view mirror flashes, saying, "Oh, because there's a sensor right pointing at me." Right. If I have lane departure, if I'm not paying attention and I cross over the lane, it beeps at me. Right. So those are all designed to be safe elements. So think of it in the next 5 to 10 years. If I'm driving on the freeway and you're driving on the freeway and all of a sudden I get distracted or something happens, I move like to the right, the car will be able to speak to your car. My car will speak to your car and say, oops, and your car will move over or slow down, or my car will automatically correct back, preventing that car accident, right? Hopefully it will also help prevent people who get behind the wheel when they shouldn't get behind the wheel.
Sure.
Right. You're seeing right now Google testing their Waymo product all over, right? These smart cars.
I rode in a Waymo a few times.
When I was in Phoenix, I rode in one just to try it. It was awesome.
Yeah, right? I did one in LA, one in San Francisco, and it is an incredibly good driver. And it's not just like puttering along the road either. It's actually like moving. It's actually doing things in very complex situations. Like San Francisco, I am fearful of driving in San Francisco, and the Waymo is avoiding people and obstacles and everything without any hesitation. Like it's just doing its job, getting me from point A to point B. So whereas before I felt that this future of self-driving cars was probably just, a pipe dream, it is happening now.
Yeah.
Right.
Yeah. And it's already doing pretty well. So again, 5-10 years down the road, imagine how good it's going to be.
Right.
Right. So that's one example, right, of that prevention side.
Sure.
So if you think about that domino effect, and you've been in the emergency room, what would you say is the amount of time you're spending in the emergency room just on car accidents in a day?
I used to do trauma surgery a lot, and I would say that 50% of our traumas, at least, maybe more, were from car accidents.
Okay, so let's say that 50% gets cut down to 20%.
Right.
So that roughly 30 percentage points comes back to you and your nurses. What do you do with that time? You can spend more time with other patients.
Exactly.
Right. So that's my idea. You can be more proactive with people because hopefully you're not as busy. Right. So that's one example.
And you also think about the cost of those, because car accidents are massive injuries.
Insurance.
Exactly.
Hopefully insurance rates drop.
Right. Right. It can make a massive effect in the cost of healthcare.
Right. So that's one example. Right. I think the other idea is, and you and I look at the same stuff. Right. So people who are blind in the future,
sure,
thanks to robotics and AI combined, will be able to see. Right. People who are deaf are going to be able to hear. People who are paraplegic or quadriplegic may be able to walk again, right? So it's those kinds of technologies that are coming down the road through this machine learning side of what AI has to bring. And that's what you need from a machine learning perspective, right? Mm-hmm. The example I talked about earlier with you was, MIT did this thing where they studied they took 30,000 breast cancer images that had already been viewed, and they ran them through their AI system, machine learning AI system. And that AI system found an additional 11 cases of breast cancer that the doctor and radiologist missed. Now, it's not their fault. It just happens. We're human. Humans make mistakes. But those 11 families, those 11 women are a lot happier today than they were, 6 months ago. Right?
Absolutely.
And so those kinds of things, the speed of which it can process, the speed of which it can find, it'll never get sick, never goes on vacation, never gets hurt, whatever the case might be. It allows the doctors now to spend more time with their more critical patients, right? The AI, along with the physician assistant, may be able to do the triage a lot better now up front than ever before. It's also being able to be, so the more proactive it can be, the better it can be. Like if you notice someone who's if you can look at the trends and the AI can identify, look, if Rajeev doesn't change his lifestyle in a certain area, he's going to have kidney problems or whatever, right? Being able to tell me that 3, 4, 5 years ago is really important, really critical, right? And so it's those kinds of things that are coming. So that's the idea of prevention.
Right.
Right.
And, I want to say on the prevention part, there's so many things people can do now utilizing AI that they might not realize that they can do. You mentioned the radiology thing and mammograms. One of our employees today went to got a mammogram. For $40 additional, they'll have the AI look at it as well and compare it to all of her past mammograms and every patient that's come through there's mammograms and give them a second opinion, basically.
Yeah.
And so that's available right now to people. So if you're ever getting an X-ray for any reason, you can ask for an AI interpretation as well, and chances are they might have it. And another field that I see AI being used a lot in is this new CAT scan of the heart. It's called the Clearly scan. And prior, a CAT scan is very difficult to look at the heart anatomy is really difficult because the heart is beating when you're in the scanner. The AI can actually figure out how to make a stable image from a beating image. And then we can look at each individual blood vessel of the heart to see if there's any blockages. So that's also available now. So if you're at risk for heart disease, you can get a Clearly scan. Have you gotten one of those?
Not yet, but I should get one.
Yeah, I think anyone that's at risk for an MI should highly consider getting a Clearly scan because it can tell you not only if you have blockages that are ready to become cause a heart attack, can tell you way ahead of time that you have blockages headed in that direction. And it can also delineate between what we call stable plaque and unstable plaque. Unstable plaque is a kind that can immediately turn into like a total blockage through a process called thrombosis. And that is available now.
That's great.
Using AI, right?
Yeah, that's awesome.
Right.
Yeah, and so if you think about that idea, right, you start thinking about then the development of new technologies through CRISPR type technologies, these biotech companies that are all popping up. You start thinking about stem cell, peptides, and the idea, the fact that AI can now you start talking about the future stuff, right? The future stuff becomes where AI can now develop new proteins, right? New sciences, new cures. Like, you talked about cancer. I firmly am with you. I think in the next 10 to 15 years, we will cure cancer. I think we will cure things like type 2 diabetes and dementia and all these things because of AI, right? Because of what's happening, right? And some of that stuff, the science is available now, right? We know Perlmutter talks about it, other people talk about it. And so those are the things, right? So that idea of the future longevity side, like the other side of the longevity side that I think that a lot of people don't think about is that when you start, and I hate to come and bring it back to the movies, but it's the easiest way to people to understand it is, like I was watching yesterday this video of a hologram. Like, if you need the best doctor, but the best doctor happens to be in India, well, the doctor will be able to hologram into you and have a full two-way conversation with you. Your doctor could be sitting in Switzerland using robotic AI-powered tools in his or her office in Switzerland while you're on the operating table here down the street at Cedars-Sinai, for example, right? So it's just that idea. Some of that exists, right? Some people do that today. Sure. But again, it's just going to get more precise, stronger, better over time. But then you come down to what I think is the biggest low-hanging fruit. It's just the overall education and trust of using the tool.
Right.
Right? And learning how to prompt in that box, learning how to prompt in that little window in ChatGPT. Storytelling and communication are skills that everybody's going to have to really become better at in order to really take advantage of what tools like ChatGPT have to offer. So Absolutely. You talked about being able to compare the two blood works. That's great. But you have to ask it say, you have to learn how to prompt it properly and say, please compare please act like, so you want to give it so the best way to do this is to give ChatGPT a role, a task, and an ask. Those are the three things you have to do to be successful with prompting in ChatGPT. Those are the three things. Again, it's role, task, and ask.
Okay, so let's go through that. Let's pretend I'm me, right?
Yep.
And I have like 50 pages of blood work, and I want the AI to evaluate it, tell me what it thinks about my overall health status and what things I can do to improve my longevity. How would I put that into a prompt for ChatGPT?
So you would start with, I always say, dear ChatGPT. Yeah. I would say, hey, dear ChatGPT, I'm uploading my past 5 years of blood work that I've gotten from my doctor, Dr. Darshan Shah from West Hollywood. And I need you to act like the world's greatest general practitioner who understands male anatomy for a 55-year-old male.
I'm 52.
Well, I'm sorry. I was thinking about myself.
I'm just kidding.
Yes, I am older than you. So a 52-year-old male with an ethnic Indian background, whatever that is, right? And then so that's the role. So I've now assigned ChatGPT a role.
Okay. And what's the task?
The task is I want you to compare all of these blood works and provide a table or a graph analyzing and showing me how my results have performed over the last 5 years. And then the ask is, once you've done that, please identify my 3 biggest risk factors for death and give me a plan to combat lowering my A1C or my inflammation markers or whatever, or maybe I don't have enough testosterone, or whatever it might be, right? Well, whatever that might be. So then give me a plan.
Right.
So the role is, we've assigned it, I need you to be this type of person. The task is analyze and create the visualization or a table. And then the ask is analyze it and then provide me with step-by-step guide and solutions on what to do. Now, I can take it one step further. I could say, okay, the result might say, Darshan or Rajeev, your A1C level is just too high. You're right there on the border. So you've got to reduce your sugar intake. I can now take it one step further and I can say, dear ChatGPT, I now need you to act as the world's greatest chef. Right? Pick your world's greatest chef.
Yeah.
Jose Andreas, Wolfgang Puck, whoever you want to pick, right? And say, I need you to produce a menu for me, a 7-day menu, breakfast, lunch, and dinner, that is no more than 2,000 calories, that it's got no more than 5 grams of sugar throughout the day.
Interesting.
It'll then produce the entire menu for you in 30 seconds.
Sure.
You could then say, please create images of each one of those meals so I have an idea what they look like. Over time, that stuff will tie into Instacart.
Right.
Can you now go buy these items and have them just delivered to my house, right? So my point is, that's the beauty of what that's going to be, right? When you start thinking about, you and I both know, right? I think Dr. Mark Hyman says food is science, right?
Right.
And so, and you've said that
Food
too.
is medicine, right?
Food is medicine. And so, imagine being able now to have a tool available to you that you could literally say, please act like Dr. Mark Hyman and produce this for me, right?
Exactly.
So that's that idea of education, and anybody can do it. And by the way, you can do that right now.
Yeah.
This
is a great tool that people can use right now. And this is why I think it's really important for people to get their biomarkers done and get a copy of them and understand which biomarkers need to be tested. And you can even ask ChatGPT that, but we also have a list that we provide people, and you can do these all over the country, all over the world. You can get your biomarkers done, and then now you have your data, because ChatGPT is kind of like a glorified search engine until you put your data into it, right? And so getting your data into it, I think, is key.
Yeah, it's beyond that. Yes, getting your data in is key, but then learning how to prompt and ask the right questions, right? Because you want to be careful. If you just go and say, hey, what are the symptoms for Alzheimer's?
Right.
I mean, you can go to Google and do that, right? But it's more than that. It's what are the symptoms for Alzheimer's? How can I, as a 52-year-old, start to prevent that right now, and then break it down from a food, exercise, and mental wellness perspective, right? And it'll give you a full plan.
Sure. No, that's just incredible. So that's on the prevention aspect. What's pillar 2 again?
The education side.
The education side.
Right.
Okay, so on that side.
And the education side is just understanding and realizing that ChatGPT, and if you want to use Gemini or Anthropic, you can too, has been trained on literally every single modality or science out there.
And what I love about ChatGPT is you can say, explain the biology of Alzheimer's to me as though I am a high school student.
Yes.
And it'll really get it down to like the basics that you need to know. And I feel like, it's so much easier now to get educated versus with Google, for example. You would ask biology of Alzheimer's and you get 1,000 different articles get sent all over the place, and you don't really know which one's right and which one's wrong and which one is like one that you can understand. But it seems like ChatGPT has now the ability, like you said, through the prompts to explain this to you, and you can go back and forth in questions with it as well.
It's ChatGPT gives you control over your own life. Right. Google doesn't do that. Because to your point, we could talk about the science of, give me the science of Alzheimer's or whatever, right? And you're going to go through all these different high-end papers and words that the layman is not going to be able to understand, right? Whereas ChatGPT, to your point, you could say, look, please do it to where I'm a 50-year-old father of 2, right? There you go. Right. It'll talk that way.
Yeah. And the other part on the education aspect that I find very helpful is if there's a book that I want to read, a lot of times what I'll ask it to do is summarize the book for me prior to me reading it. So that way I get like a good big picture overview of the book as well. So I just read, what was the book I just read? Longevity by Dr. Mark Hyman, for example. And the summary is so helpful to like guide your reading path as well. Or you don't even have to read the book if you don't want to, but it ties in so much knowledge out there. And it actually is fun to use, I feel.
Yeah, so I did the same thing with Peter Attia's book.
Right.
Right. Oh, right. It's a big, thick book. Yes. It's a long book, right? It's a great book, right? So literally I went to ChatGPT. I said, can you summarize the top 10 key takeaways of this book? And given my time is limited, can you rank the chapters in terms of which ones you think based on my lifestyle, what I want? And then I put my lifestyle, what I'm looking for, all that. And it says, oh yeah, you want to go to chapter 4, talking about whatever it was, right? So again, so that's absolutely, but again, that's part of the education side of things, right? Being able to understand and realize you can now have control of your life and have these tools available to you. So you don't have to wait to go to the doctor. You can start doing these things now, and it makes you more educated. So the other thing I do is that if I'm going to go see my GP and I have my results and I want to do a follow-up, I could say, what questions should I ask my doctor? I can have ChatGPT coach me, be my coach for my health too. Saying, I'm going to go visit Darshan. What questions should I be asking him, about my inflammation that perhaps I may not think about?
Sure.
And it'll give me 5 or 6 questions. And I can just print that out, walk in the office and say, Darshan, boom, 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 right? And so again, it's ChatGPT is not just a, hey, pretend to be a doctor. ChatGPT is, hey, I'm going to go visit my doctor. What are the questions I should be asking? Because you know what? My dad had high cholesterol, or my dad's still with us, but has high cholesterol or blood pressure challenges. I want to make sure I'm fine without those kind of things, based on the family history, my mom's family, all my mom's brothers passed away of kidney problems. Now, I could ChatGPT, what are those types of questions I should be asking Dr. Shah when I go visit with him about those kinds of things? And so having ChatGPT be a coach for my health, a coach for my life, is something that's completely underrated, that's flying below the radar, that people haven't even thought about yet. And so if you're listening to this, use ChatGPT if you get stuck to also give you the questions to ask your doctor.
Right, absolutely. So, it brings up just empowerment to me. Like people are now empowered to the point where you're coming very close to having your own personal doctor sitting next to you all the time that can help, and definitely a health coach at the very least, that can prompt you and teach you what to ask and help you interact through the medical system. Now you don't have to wait for another human to do that for you. The ChatGPT can literally perform that function for you. And it's just mind-blowing to me.
Yeah, and again, absolutely. And again, let me ask you a question. Do you ever see patients where English is not their primary language?
All the time, right?
Right? Mm-hmm. So ChatGPT, because of its multimodality today, is you can now take your phone and you can say, hey, ChatGPT, I'm with my patient, Rajeev. Rajeev only speaks Hindi. I only speak English. Whatever I say in English, translate to Hindi, and whatever he says in Hindi, translate to English. Real time. Right? And over time, that'll be in the AirPods. Right. Real time, that'll be because of processing again, right? Because we're blowing through that Moore's Law concept, because processing is so strong and it's moving so fast, that will become real time. So this idea of language barriers will completely disappear. Right. Completely. So now we start thinking about the fact that since we talked about ChatGPT being trained on basically the global medical world, this also includes Eastern medicine. Yes. Right? It also includes what's happening in Germany, in India, in Japan, other places, right? Think about the blue zones. The question might be, how can I live a blue zone life in Malibu? How can I live a blue zone life in Irvine, right? And so it can do that. And what are some of the homeopathic or functional things? So now being able to design a whole life program for you, ChatGPT can do it. And a doctor who specializes in nutritional Western medicine may not be able to do the Eastern medicine side of it, right? You have to go see 2 people or 3 people or 4 people to get that done. I firmly believe, had we had these tools, whatever it was, 10, 12 years ago, Steve Jobs, for example, would still be alive because he wanted to go down a path treating his pancreatic cancer with some other other ideas. And, and so you and I both know Dr. David Agus, right? And I remember he came and spoke to our YPO chapter and we asked him the question. He said, he told us, he goes, look, had Steve done both early on, he'd probably still be with us, right? And so no one has an excuse anymore. It's all there. It's all real time. Everybody has access to it. You just got to learn how to write the prompt.
Right. Absolutely. I want to dive in a little bit into a concept that I talk to my patients about and how ChatGPT addresses this, and that is the concept of N of 1. So N of 1 basically means that, there's a ton of research out there, but research, whenever you look at it, they're taking the average result of hundreds, thousands of people and saying, this is what happens to most people. But when you look at most people, that's what falls in the middle of a bell-shaped curve. So you have the outliers that fall on the outside of this bell-shaped curve. So if you're a person that you fall on the outside of that bell-shaped curve, whatever the research is might not apply to you as strongly, right? So for example, you were mentioning hemoglobin A1C, which is a measure of your average glucose level. For some people, we say the average is 5.2. That's where you want to be. But other people might need to be even lower because they have a higher risk of metabolic syndrome, for example. That's one example. So the way this ties into AI is now, whereas before doctors are basically really trying to see hundreds of patients and try to apply the knowledge to a large patient population, ChatGPT can actually apply it to the N of 1. So they could take all of that knowledge and apply it just to you.
Absolutely.
But it's important to train ChatGPT in you so it knows who you are, both from a history sense, your medical history, but also your what's going on, your biomarkers and your biology at that moment in time. And so this brings up this concept in ChatGPT, which is now there called memory, right? So I would love for you to talk, because this was not there before and now it has memory.
It's a relatively new advancement.
Right. Okay. So if I want to train ChatGPT in my biology, can I use this memory function so it knows who I am and keeps that data inside of it when I ask it questions later on, for example?
The short answer is yes.
Wow.
Right. The short answer is yes, because it's got that memory function.
Right.
It remembers your interaction it's having.
Right.
I can go back into my ChatGPT and ask it a question that, as a follow-up to something maybe I did 6 months ago, and it's going to remember that. Right. So I was using ChatGPT to analyze a legal thing for work that we're dealing with this past week. And I initially asked it a question about California law, right? And this was like 6 weeks ago.
Sure.
And so yesterday, I went back in and I uploaded a settlement agreement, and it pulled back from that from the question I asked 6 weeks ago. Right. So and again, so it's not just the medical side; it's everything, right? So the more you are willing to get over the fear of ChatGPT, the more you're willing to put your information, your life into it, the better your results are going to be. Now, there's some concern about privacy. My fear, let me back up. I don't really have a fear on privacy. And there's a couple reasons why. Number one is the chance of anybody learning anything about me, about my A1C level. No one's going to be looking for my A1C level, right? So that's number one.
What about the insurance companies? What if the insurance companies are life insurance? That's the concern I think a lot of people has. Like if life insurance gets access to this data, they might deny you coverage, or the insurance company might deny you coverage or increase your premium. Do you think that's a risk?
Yeah, I think that is definitely going to be a risk, but they're doing that already anyways, right? They can within, I mean, you know this better than me, like very close, say Rajeev is 56-year-old, Indian male, blah, 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 whatever it might be. They can pretty accurately diagnose and say, because they ask you, what's your weight? They get your blood stuff, right? When you
give it to them anyway.
You got to give it to them anyways, right? So they already know, right? And the thing with insurance companies, life insurance companies, just regular insurance companies, is they just have huge data sets that they are now in the process of doing exactly what you're saying. Right. So instead of it being a one-to-many insurance plan, it'll become a one-to-one insurance plan. Wow. So think about car insurance.
Sure.
Over time, smart cars, the data's got to go somewhere. And these car companies are going to sell it to the insurance companies. And oh, by the way, it's going to save your life. But at the same time, okay, is that a trade-off you're willing to take? And I think most people will say yes. If it's going to save my life, or my kid's life, or whatever the case might be, sure. I don't care if they have my information because they're going to have it anyways.
Right.
That's number one. So number two is there's so many data breaches happening every day. It's like every time I wake up, there's a new data breach.
Right.
So that's number two. And then number three is every email I send in Gmail or Outlook, Microsoft and Google already have access to it. So if you were to email me my results, which you would in Gmail, Google already knows it.
Sure.
Google already has it. And I know they won't admit it, but I would not be surprised if they're taking our Gmail information and using it to train their Gemini product or or even their MedGemini product, which is the medical version of their ChatGPT. So I'm not super concerned. You know, I know some people are worried about this stuff, but
the benefits outweigh the risk.
I think the benefits I think it way outweighs the risk.
What was the third pillar you had mentioned? The future.
So the future is where we started talking about really the more longevity science of things, like the CRISPR technologies, the robotic technologies, the idea of the holographic image coming in and treating you, the idea of the fact that I believe in the next, just like you, in the next 10 to 15 years, we're going to cure cancer. And we're going to be able to do these things because we can process that data so much faster. And the processing speed and being able to come up with new proteins, new solutions, new cures is going to be key. And look, I know Moderna and some of these places are already starting to do these things and play in this space. And they're already looking at creating, they already have huge, they're in the process of getting supercomputers, and, they're all begging Jensen Huang to please give us the, we need more GPUs. We need more GPUs to do these things. And so they're all doing it, right? Wow. And so you also have to ask why. The reason why is because Musk and Bezos and Gates and all these guys, Ballmers and all these guys and the Michael Dells have so much money, they want to live longer to enjoy it. I believe, you've heard me say this before, I believe that over time, the average age could spike to about 120.
Sure.
And we know Brian Johnson. Now, Brian wants to live forever, right? Now, he's also come out and said that he realizes he's probably not, but at the same time, think about all the data he's creating, just what he's doing to himself and the amount of money he's spending on his own body and all the results he's getting, the data he's putting out there, right? Is being able to take all those things and learn it at a mass. Can you imagine taking what Brian's doing at a mass level?
Right.
That's amazing to me, right? And those are the things that are going to allow us to understand what that, we talked about, I think at our longevity summit, someone asked a question about Wim Hof. Right. Yes. Mm-hmm. And so for those of you who don't know, Wim Hof's this guy in the Netherlands, and he does this breathing practice, and it's just go look him up. And so, he's been poked and prodded with all kinds of diseases. Sure. But by using breathing techniques and cryo, he's able to fight these things off. Right. And so why? And it's there, right? So the data and the science of what Brian's doing on an individual level, right? Or even like what Colin did, walking across the Antarctic, or his heart rate riding his bike across the country with his buddy. Just those kinds of things are all going to be available to us from a scientific basis to help really understand and engineer what the future of humankind can look like. And so I believe it's going to be those things. It's going to be all the things that Mark Hyman talks about, and the types of foods you eat, the food as medicine side, the things you talk about, right? That you talk about in your talks. And your talk is amazing, right? You came to our YPO chapter and did an amazing talk for 2 hours. It was fantastic. And the wheel of life, essentially, right? And how to be preventative in those areas. So you take all that stuff, which right now feels like a one-to-many solution. And because of ChatGPT becomes a one-to-one solution, Darshan. And that to me is amazing. It's going to be able to do those things. So it's the idea of realizing that it's not crazy to think that we're not going to have exoskeletons for people.
Sure.
And I'm not kidding. People who are blind will be able to see, and who are deaf and be able to hear, robotic limbs, it's all those things, helping improve people's quality of life. And the benefit of those things when you're doing these things, there's a huge mental wellness benefit too.
Right. And that, I want to touch on that too, because you said this at the beginning of our conversation, that you can actually talk to ChatGPT anytime you want to, and it can act as a therapist. And it's a free therapist, basically. And, I feel like the mental wellness benefit to that, once you get over the hurdle that you're talking to a computer, can actually be extremely beneficial, especially when this thing has knowledge of all the different mental wellness techniques and you can prompt it correctly as well. So that's another tool I want to bring to people is what's a good prompt for if you're struggling with maybe depression or anxiety, what's a good prompt to put in before you start talking to the ChatGPT to have a dialogue with it?
Again, the same concept, the role,
Okay.
the task, and the ask, right?
Okay.
Hey, ChatGPT, I need you to act like, an amazing
Psychoanalyst,
therapist who has a lot of experience in dealing with depression, right? So you want to put that in there, right? I'm a 55-year-old male. I'm struggling in my work and with my marriage or whatever whatever that's causing whatever you feel is causing, right?
Sure.
I feel like I'm getting more and more depressed, and I really just feel like I need somebody to talk to. Can you please have can we please have a conversation about ways I can help mitigate my depression, or would you be willing to just have a conversation with me and just be a friend to listen? Sure, no problem, Rajeev. Let's have that conversation, and boom, you go. And anybody can do that. Like I worked with a YPOer, and he's having some health challenges, and he's in the Southern 7 chapter, which kind of covers like the Ozarks, kind of all that area, right? And so he's facing a health challenge. And I told him, just start using ChatGPT. Just start talking to ChatGPT. I told him what to do, just the same way you and I are having this conversation. And now, every morning going to work, he has a full two-way conversation with ChatGPT. First, I started about his mental health. Then I started about his overall physical health.
Wow.
Now he has full two-way conversation with ChatGPT talking about business ideas.
Wow.
Nothing even health related.
Yeah.
And ChatGPT can be an amazing brainstorming partner, which we even touched on or even talked about, right? So now he does that, and he gets the full transcript.
Right.
It's still there. It's his own conversation. No one else sees it. He can go back and read through the conversation. He goes, sometimes I go to work, maybe a break. I'll sometimes go back and read through the conversation that I had, and it makes me feel better. You can use ChatGPT to become a meditation partner with you.
How do you do that?
Same thing. You prompt it that way and say, hey, ChatGPT, I need you to become a meditation partner with me. And I'm going to set a timer for 3 minutes. Please act like a meditation teacher and guide me through a full meditation.
Wow. I did not know you could do things like that.
I mean, yeah, but that's my point. It's the education side that's still coming. Just like when the internet came out, I didn't know I could do that. I didn't know I could do that. I didn't, right? But the difference with the internet was that we needed to build solutions into the internet.
Right.
The solutions here are already there. Now we need to build solutions to pull the data out of the internet, so to speak. Does that make sense?
Makes total sense.
Right. So that's the difference. So the idea of education and is what's going to be really critical. That's why to me, education is that middle pillar that connects those other two that we talked about, right? You need to do that. Without that education, it's just not going to work. And again, don't treat it like a search engine because it's not a search engine. You need to be able to really ask the question the right way. There's amazing. My book talks about how to prompt. If you don't want to read the book, go to YouTube and watch some YouTube videos. Whatever the case might be, right? We'll go to whatever X or
Learning to
Instagram
prompt.
or just use it and have ChatGPT. Hey, ChatGPT, I really need some help learning how to prompt. Can you give me 5 prompts for mental wellness that I can use? And you get those prompts, copy them, paste them into a new window, and then modify them to fit whatever you want to do. And use ChatGPT to help you write the prompt.
That is incredible. Yeah, I mean, there's so many uses for it in healthcare already that, beyond like uploading your biomarkers, talking to it for mental health, getting your mammogram read by an AI. There's so many different uses already that I just can't imagine how incredible the future is going to be with AI in healthcare.
Look, I'll give you another example, right? So I got a friend of mine, she's an OBGYN, and she's using it for birth trauma.
Tell me how.
So I don't know all the details behind it yet because I've been helping her a little bit, but she is gathering all the data around birth trauma and how that affects the development of the baby.
Sure.
Right. Birth trauma might be a really hard birth.
Right. Hard delivery.
Or maybe the baby's born HIV or some other, whatever it might be. Right. And what is that trauma? How does that impact the development of the baby into a young child. And so, yeah, she's getting all the data, and now she's loading up that data, and she's using ChatGPT and to help come up with, what to do when there's a hard delivery. What are the steps that she can now send the parents home with?
Got it.
Right. So a C-section versus natural birth, for example,
Sure.
might have a bit more trauma on the baby than a natural, for example, or God forbid the baby is inverted, right? During things,
Breacher.
or maybe the epidural didn't take, and it just happened to be a traumatic birth for the mom as well, and that causes an episiotomy or whatever might
Sure.
happen. Just whatever that birth, how can now she provide information
Right.
to her patients on, okay, this is what happened. These are the things you have to watch out for. These are the ways. These are some of the what you need to look out for. The other thing is I think is going to be is you talked about stem cells, right? When the baby is born, she can now
Sure.
she wants to make sure, but he's keeping the stem cell.
Absolutely.
Keep the stem cell blood.
You should bank at least the umbilical cord blood, but if you can bank actually the entire umbilical cord or the placenta, it could be very helpful because we're discovering different types of stem cells in the placentas as well. So anyone listening, ask to bank the placenta as well.
Right, and if you do that,
Yep.
as technology evolves,
Sure.
the AI will come in and help figure out, again, because it's data, right? The AI, whether it's
DNA is just data.
yeah, it's just data. That AI data, some bigger brain than us will figure out some solution, right? We'll say, oh my God, this person has got XYZ, boy, but we've got this placenta or the umbilical cord blood, and we can use it to cure the issue that he or she might be facing.
Another way that I found very helpful with AI too is if someone's on multiple medications, to upload those to AI and ask it what are some potential interactions and contraindications, because I feel like doctors and pharmacists are both very busy and they're not really watching. I mean, they are watching, but it's hard for them to watch everything. And so just as a kind of a double check on the prescriptions that you're getting, on the advice you're getting, it's a good way to kind of double check on your own what you're being told to do.
Exactly. So I have a friend of mine who he was taking blood pressure medicine.
Okay.
He's on 3 different blood pressure medicines. And he noticed that whenever he would stand up, he'd get that dizzy, fainting, like that kind of vertigo feeling for 3 or 4 seconds while he stabilizes himself. And it turned out that he'd been working out, losing weight, whatever. And it turned out that it's happening because his blood pressure was dropping because he was just taking his blood pressure medicine. So I said, let's put, and we could have taken pictures, but we didn't. So I tell me the name of the medicines, whatever they were, right? Amlodipine and whatever, a couple of other ones, right? We put them into ChatGPT and we said, we noticed that this friend of mine, every time he stands up, feels this way. And then ChatGPT came and said, okay, well, let's start first by reducing the dosage, whatever. But then it said, stagger the dosages throughout the day, right? So take one in the morning, take one in the afternoon, take one in the evening, stagger that. And when he started following the different recommendations ChatGPT made, now he doesn't have a problem.
Yeah. See, that's incredible. I do think it's important when you're getting recommendations on medications to definitely talk to your doctor as well, though, right? Because I think that the ChatGPT, it's still not your doctor and it still can't be held liable for anything that goes wrong.
Yeah, of course.
I think you want to definitely talk to your doctor, not because of liability's sake, but also you just want to get yourself in trouble by following something that ChatGPT said, not by double checking. Right?
Yeah, no, look, absolutely. And I'm not saying that I'm not saying that he shouldn't have talked to his doctor. What I'm saying is that it's just that immediate
the immediate advice.
The immediate challenge of, oh my God, why am I just getting dizzy? Am I having a heart attack? Am I having a stroke? Like, if you feel like you're having a stroke, go to the emergency room.
Yeah.
No, I don't think I have a stroke. Okay. So what's going on? So we just put in ChatGPT.
Yes.
So anyways, but the other challenge, I think, again, coming back to the doctor side of this, is that doctors are super busy.
Right.
Like getting an appointment, like for me, and I got good health insurance, getting an appointment for me for my physical is like almost 90 to 120 days out.
Yeah, absolutely.
Right. So like my doctor's cool because I can text him and he'll respond back to me. May not be that day, but maybe the next day. But not a lot of doctors allow for that, right? So you might have to, depending on your doctor, your type of insurance you have, you might not be able to connect with your doctor for 3, 4, or 5 months, maybe potentially on what it is, unless you go to an urgent care or go to the emergency room. So again, it was just a small example.
Sure. These are all great examples.
Where he still kept the same medicines,
Sure,
but he just staggered it to help reduce the fainting and dizziness he was feeling.
And I think what's great about that too is that the doctor, when he finally did get into the doctor maybe a month later to talk about this, he could have fallen and hurt himself in the interim time period waiting to see the doctor and getting that advice as well. So this is a great way to just kind of get the advice right there on the spot in real time. And of course, make a phone call, make sure the doctor thinks it's okay, but you put it into action like right at the moment these things are happening. It really cuts down the time to treatment.
Yeah. So he was supposed to go, I think, talk to the doctor this week or late last week, whatever. But,
Problem's already been solved.
But I mean, again, because most doctors will come and say, okay, well, take it in the morning or take it in the evening. Take one in the morning, take two in the evening.
Or they'll cut the dose or something else.
So they're going to say that anyway. So.
Yeah. Right, exactly. Yeah, it's so interesting how AI can already function as a doctor or as a lawyer or as an engineer. And it's so well trained that it can actually give you advice that the doctor's like, oh, that's actually pretty good advice. It's just mind blowing. And this is just like the beginning stages, like you said. Pretty soon, it's going to have like PhD level intelligence.
Yeah, by end of next year, it's at PhD level. You mentioned lawyers and legal, right?
Yeah.
So there was a case that happened last year, hallucination. Let's give you an example of hallucination, where a lawyer used ChatGPT and ChatGPT produced some result, and it made up cases, and it was all fake, right? It hallucinated the cases.
I read about this. Yes.
It hallucinated the cases, right? But now. You do go today, ChatGPT is now connected to the Bing search engine. So now it shows you the link of where you can click on to go see where it pulled that data from.
It annotates it.
It didn't have it before.
Sure.
So again, that's another example where it's just gotten better, right? Again, so it's just going to take time. This stuff's going to get better. But if you were to ask me what is my biggest fear of AI, it's deepfakes.
Right.
To me, deepfakes are hands down the most dangerous development to humankind since nuclear weapons. As much as we can get this information about our doctor, what's preventing somebody from pretending to be your doctor?
Sure, absolutely, yeah.
Or somebody could take 3 seconds of your and my voice from this podcast, our imagery, and make us and say and do things that we never said and did.
Exactly.
Right? So those are the things, that's the only thing in this AI world that keeps me up at night.
Sure.
Right? That's the thing that worries me. There's so much promise, but that promise could be completely derailed by this issue of deepfakes.
And the issue of deepfake, which I also agree is a massive issue that's already here. Because if you look at some of the deepfakes that have already been produced, they're very believable.
Yep.
Can't that be legislated against?
It can be.
Right?
It can be. There's going to have to be some sort of regulation.
Sure.
California Governor Newsom just signed the anti-AI imagery and voice for Hollywood, right? But it's got to go beyond that. That's not the issue. The issue is taking Taylor Swift's face and putting it on someone's body, doing things that she didn't do, or someone recording, my voice or your voice saying something in support of something that we did not agree with at all, right? Or, there's a political candidate who took his image and surrounded himself with an ethnic minority group to say, look how popular I am with this ethnic minority group. Okay, harmless, but still it's being meant to influence in a certain way that it's not true. So the challenge is going to be how are we going to be able to determine what's real and what's fake, right? So that's going to be the issue. There may become a time where we won't know. So unless companies and governments really start to figure out, put some rules and regulation around some of this stuff, it's going to be very difficult. It could really impact and harm society in a negative way. And so to answer the question, yes, there has to be some regulation. Right now, individual states are coming up with their own. There has to be something at the federal government level and at the state level. The good news is California is pretty ahead of this stuff. And I would put the onus on I would put the onus on the Metas and the Googles of the world, to really proactively watermark things as being fake, because they know.
Right.
To do that. But the hard part is going to be getting this done globally, because China, North Korea, Russia, some other countries may not be so open to wanting to become part of a global regulatory body on this whole thing. So just like we have the IAEA for nuclear weapons, I think there needs to be the IAIA, right? The International Artificial Intelligence Agency, right? To help regulate this stuff on a global basis. It has to, at some point it has to be there.
Absolutely. I mean, look, with every new technology, there's challenges and there's massive benefits. And it sounds like you're on the opinion that there's many more benefits than the challenges here, but we still have to be very cognizant about the challenges.
Yeah, I mean, sure. What are the biggest challenges? Some potential privacy concerns, but like I said, there's a data breach every day.
Yeah.
To me, the deep fake thing is the biggest challenge. The job thing and job loss could become a challenge, just depending on on what happens with the solutions that get created. At the same time, I think more and more people are going to become entrepreneurial in terms of what they're able to do. But on the job loss side, again, I come back down to, you're going to lose your job if you don't learn AI. That's when you're going to lose your job. But deep fakes, cyber scams, things like that, those are the things to watch out for on the negative side. But some of that stuff's already out there. The cyber scams and those things are already out there.
I love it. So the big takeaway for this podcast episode was learn AI. You've got to learn AI. It can have massive benefits in your health journey. There's many tools you can use right now already to benefit your health. And if you're not using them, you need to learn to use them. And the best way to do this is to find this book that you wrote.
AI Made Simple.
AI Made Simple. And it'll teach you how to do things like prompting. It'll teach you how AI works. What other things can we learn from this book?
Look, I wrote the book so my 80-year-old mom could understand AI.
Great.
Right? So that's kind of what it's geared towards. I couldn't call it AI for dummies for obvious reasons. So it's a real beginner's guide to generative intelligence.
Okay.
And it's all about what are some of the common words? What's the lingo of AI? How to prompt? How to use some of the other features available through ChatGPT, like DALL-E, and some of these, like the advanced data analysis piece, which is the upload our blood work conversation we had.
Sure.
But it doesn't be blood work. You can upload 2 Excel files. Like, one of the things we're doing is, like, if we ever want to buy a company, we'll upload the asset purchase agreements and have it go through and help it analyze and say, like, what's the difference between the red line version and the clean version, right? So we talk about that a lot, right? The visualization side, the data visualization side of those whole things. And so the plugins that are available, the ChatGPT store that's available, all those things, right? So it's really done at a really basic level. Again, it's designed for the masses. It's designed for the general masses who are looking for something basic and easy to understand how to use AI.
Fantastic. I love it. Well, thank you so much, Rajeev, for joining us today.
Thank you for having me.
We learned a lot about AI and how to use it for your health and other things, and look forward to having you on again. It sounds like this world is changing so rapidly. I'm going to have you on every 6 months to talk about it.
Yeah, let's do it. I'm happy to do it. Thanks, buddy.
Thank you so much for coming.
My pleasure.